When electrosurgery is used in the context of minimal access surgery, it raises a new set of safety concerns. Direct coupling, insulation failure, and capacitive coupling. We'll deal firstly with direct coupling. This is the accidental activation of the generator while the active electrode is near or touching another metal instrument. In this case, the secondary instrument becomes energized, and the energy seeks a pathway to complete the circuit to the patient return electrode. So, if this energized instrument is in contact with, say, bowel, then this area of bowel will receive the full power of the generator. Not only that, this will very likely be outside the area of vision and will go unnoticed. There is potential for significant patient injury in such cases. Insulation failure. In cases where the outer plastic coating of an electrosurgical hook or similar instrument is damaged, voltage can spark through the compromised insulation. This is especially possible when in coagulation mode, due to the considerably higher voltage. Not only that, this high voltage can also blow holes in weak insulation. Once again, any injuries caused in this way are likely to occur outside the scope's field of view, so you will be unaware of any injury being caused at the time. Capacitive coupling. To understand this hazard, it is worth revisiting some basic physics and to remind yourself of what the definition of a capacitor is. A capacitor occurs whenever two conductors are separated by a non-conductor. As illustrated here, an electrostatic field is created between the two conductors, and, as a result, a current in one conductor can, through this electrostatic field, induce a current in the second conductor. The importance of this will become apparent when we consider how we can create an inadvertent capacitor by the composition and placement of surgical instruments. Consider this setup using a metal port. Here we have a conductive active electrode surrounded by non-conductive insulation, in turn surrounded by a conductive metal port. As you can see, we create a capacitor with this combination, but this combination is quite safe. Although the port becomes charged each time the electrosurgical instrument is activated, the energy is readily dissipated safely since the port is in direct contact with the abdominal wall. In this video clip, you can see the capacitive current discharging from the port onto the tissue. This is the energy that usually dissipates over the abdominal wall. If using a plastic port, capacitive coupling is not entirely eliminated since the patient's conductive tissue completes the definition of a capacitor. This combination is quite safe also. The worst combination, and the one you must be aware of, is what is termed the hybrid setup. You should never construct this system. It occurs when a metal port is held in place by a plastic anchor or olive, as illustrated here. Once again, the metal port creates a capacitor with the active electrode, but this time the plastic anchor insulates it from the abdominal wall. This insulation prevents the current dissipating through the relatively large surface area of the abdominal wall, and thus capacitively coupled current may exit to adjacent tissue in the abdomen on its way to the patient return electrode. This has the potential to cause significant injury to the patient. Another scenario which must be avoided not only because it is dangerous but also unnecessary is where a metal reducer tube is inserted inside a plastic port. So, the main recommendations in minimal access surgery are Inspect the installation of instruments carefully before use. Use the lowest possible power settings you can to achieve the clinical effect. Use a contact mode of coagulation current to desiccate the tissue and provide hemostasis, and then use the cutting current to divide the tissue if it has not yet divided. Use brief, intermittent activation, not prolonged activation. You should tap the pedal rather than activate the electrosurgical generator for prolonged periods. Do not activate the instrument in open circuit, that is, when the instrument is not either in contact with the tissue or within very close proximity when fulgurating, as this can cause what is termed ramping. This is when the charge on the instrument builds up to dangerous levels and then suddenly discharges to the tissue, causing severe burns. Do not activate in close proximity or direct contact with another instrument. Remember the concept of direct coupling. Select an all-metal or all-plastic port system as the safest choices, and remember, do not use hybrid port systems that mix metal with plastic. You should be aware of the hazards which apply particularly to minimal access surgery, including the concepts of direct coupling, insulation failure, and capacitive coupling. Also, recognize the potential hazards of using coagulating current in the constrained environment of minimal access surgery. And finally, don't forget that the electrosurgical generator has been described as the most hazardous device used in the operating theatre on a daily basis.